We have a really important role supporting innovators. So we support those within the NHS who have good ideas, and we also support companies who have technologies that might be able to integrate into the current clinical pathway. AIATELLA is a company that we're supporting which has artificial intelligence technology that allows you to look at scans and see whether or not people have risk factors for heart problems, vascular disease much earlier, to allow you to put in place a risk factor modification really early.
I founded AIATELLA back in 2022 in response to a problem that I had observed during my training as a biomedical scientist. And that was the limitations of cardiovascular imaging analysis. Those limitations being how dependent they are on who's actually reading them, how complex it is to read them, and the time that it takes to do so. It's a heavily manual process done with click and drag measurements with a computer mouse on medical imaging, and that requires a specialised doctor with quite a lot of expertise, but more importantly a lot of time to do a single patient, up to 20 minutes per scan. So by using AI to automate those measurements, we can actually produce the same result in less than a second. The Health Innovation North Cumbria has acted as that bridge between innovators and the NHS, not only to help with my understanding, but providing services to support my innovation pathway. When I first reached out to the network, I had done it the hard way, trying to get into the NHS and to start with developing clinical evidence. I was making a lot of mistakes, learning a lot of hard lessons. So the involvement with the network basically clarified the pathway, the innovation pathway, the absolute stages that you must go through to demonstrate your innovation, demonstrate the safety, and also how to commercialise that. I've also been provided access and support to access things like grant funding to support our regulatory work, which is a key part of a medical device innovation. And in addition to that, support with grant applications, which are a key part of driving a medical innovation and getting it to market.
So these technologies allow you to identify people earlier and reduce people's risk and hopefully prevent them ever getting to the point where they have a heart attack or a stroke. So if we can manage blood pressure, manage cholesterol, identify people early, then that reduces their risk and reduces the consequences of heart disease.